Hi, welcome to Ask Dr Tan. Now, this is a new segment that we're doing. Every week, we try to answer questions that we get from all our social media platforms like FB, Insta, and Telegram. So please continue to ask your questions, and maybe we'll pick your questions out for next week. Now, for this week, we are going to talk about infertility. Right? So the top 3 questions that we received. The first one is, when should I suspect I have low fertility? Well, let us look at the definition of fertility by the World Health Organization. So the World Health Organization says you are infertile or you're subfertile if you have been actively trying for 12 months and still not pregnant. So please don't go with the mistaken impression that it's a sure thing, what we call in the army, one shot, one kill, right? Like you try this month, you definitely get pregnant this month. You have to actively try for 12 months. Now, for slightly older couples above 30, we actually tell them to maybe start looking into it after 6 months of trying, because there's a little bit of a time pressure. So if you've been trying for 12 months and you're still not successfully pregnant, maybe it's time to speak to your doctor. The second question is that ideal time to have sex if I want to get my partner pregnant? Okay, very good. So the important thing is when the lady ovulates, right? You need ovulation, you need the egg to be present in the fallopian tubes in order for the woman to form pregnant. So when does a woman ovulate? Around the middle of the cycle, but this is a rough estimate. So there are a lot of calendars and apps out there that help you determine ovulation time. But honestly, the most accurate way to do it is with an ovulatory predictor kit. You can get this from any pharmacy. How you use it is you get the lady to start peeing on the kit about day 10 of the period. So day 1 is when the period starts. So about day 10, and you'll find around day 13, day 14, you get a little smiley face on the stick. That means the next day, she's going to ovulate. So the day before ovulation, so when you see the smiley face on the stick, the next day and the day after, those 3 days will be the most fertile period. So those 3 days is when you work the hardest. Right? And our third and last question is, can my job affect my fertility? Okay, this is very interesting. So one of the biggest causes of subfertility in men is actually an increase in temperature around the scrotum, around the testis, right? Because we know the testis needs to be about 2 degrees cooler than core body temperature to make healthy sperm. So if the testis is too warm for whatever reason, then it can affect sperm production. So certain jobs, like being a chef, so standing with the fire literally at your groin, can affect this. Like if you have a job that requires you to spend a lot of time in the sun, walking, standing too long, it might cause blood to pool around the testis and also affect this. These days, I guess fewer people in Singapore work in things like textile or dye factories that expose them to certain chemicals like benzene that can also affect fertility. Now, one of the big things that we do in our modern world, in a lot of office jobs that we do, is we use laptops. And a lot of us like to put the laptops on our lap when working. Now, the heat from the laptop can also transmit to the scrotum, so that's actually not a good thing to do either. Right? So yes, there are certain things in your job that may affect your fertility. So I think that wraps up our 3 questions for this week. I'll catch you next week for our next segment of Ask Dr Tan.